There's been a lot of uncertainty about the future of what's called Obamacare, officially the Affordable Care Act. A new president and Republican-controlled Congress say they have plans to repeal the federal health care program. In this week's Your Community Health with Arnett Health, WENY's Renata Steele talks to a doctor about his thoughts on the future of health care.
Hello and welcome to this week's edition of Your Community Health. I'm Renata Steele with WENY News, and I am joined by Dr. Richard Terry, and we are talking about the Affordable Care Act. There is a lot of talk regarding what is going to happen with the health care plan once there is a change of power in the White House. A very timely topic. Dr. Terry, what are your thoughts on this time of uncertainty with the future of the Affordable Care Act?
Well, you know, I have very much I believe that the Affordable Care Act has made an enormous difference for people who did not have insurance having access to insurance, and I think that's been very, very beneficial. On the flip side, premiums, not so much in New York, but elsewhere in the country, have risen astronomically, 100% in some cases, which have made it unaffordable for some folks. I know there's a tax rebate that they're supposed to be able to get and deduction and such. The reality of the matter is, though, there are aspects to the Affordable Care Act that are good. For example, the fact that an insurer can no longer deny patients health insurance based on pre-existing conditions. Because in the past, they would. Folks with advanced diseases, cancer and such, would have no access to care, and now they do. So we have to figure out a way to preserve that. What needs to be changed, though, is the costs and the way things are done. The costs in healthcare continue to rise at basically a level which it's not sustainable for anybody. Hospitals are losing money, physicians are going out of practice. There has to be a way to have some cost controls, and the way that can be achieved would be to opening up the insurance market such that insurers could insure across state borders. You would not be regulated by all of the heavy state regulations that vary from state to state, kind of like, if you will, auto insurance. If you can purchase that from anywhere, and basically it's not a state-regulated kind of mandate. With that, I think we can preserve some the strengths of the Affordable Care Act and perhaps make it more affordable with cost controls and such. That would be one area that I might focus on. I do not believe they'll throw the thing out at all. I think it will create a disaster more than we already have in healthcare. But I do think with some fixes they can make it so we can at least control the costs and not penalize those folks who do have insurance through their employer, such that their premiums don't continue to have these 8, 10, 20, 30, sometimes more % annual increases, which basically make that unaffordable to folks who who have worked for large companies where they pay a significant part of their health insurance.
And there are a lot of people out there that currently have health insurance through the ACA, and they're worried that those plans that they have are going to go away.
Exactly, and I don't think that's going to happen at all, Bernard. I think that though much has been said, I think that hopefully both parties will work together and keep the virtues of the Affordable Care Act, because there are some, and as a clinician I certainly see that. Having my patients have greater access to care, and they're more willing to come in and see us because they have insurance, whereas in the past these patients would never come in, they would never have a primary care doctor. They would simply show up in the emergency room, often sicker with more advanced disease, and it's harder to treat at that point.
Absolutely.
So there has been some value to it, but the downside has been just that it has not led to the level of cost control that was predicted. It just simply hasn't. And the other aspect of it is folks who were healthy would rather choose not to purchase health insurance and pay the penalty rather than actually have health insurance. Thus, you're left with people who are sicker, more ill, who are paying it, and it's not enough to sustain the program financially.
All right, well, Dr. Terry, thank you for your thoughts on that, and it's certainly something that we'll be paying a lot of attention to going forward in the coming months and years. So thank you, and we want to thank you for joining us for this week's edition of Your Community Health.